Today I want to talk about unpredictability in outcomes after rhinoplasty, the changes the nose goes through after surgical rhinoplasty, a week, 2 weeks, 3 months, 6 months after, even years after rhinoplasty, and how being laser focused on your craft and being dedicated to one craft really improves the outcomes and limits the amount of unpredictability. And that is a very important topic. It's chapter 30 in my book, The Smart Guide to Rhinoplasty, everything you need to know before you get a nose job. It's available on Amazon. If you're thinking about getting a nose job, I think it's a tremendous resource to help you through making the right decision, the decision that's right for you anyway. So when you go to the dentist, an aesthetic dentist, you want to get some veneers. You sit in the dental chair, they take an impression of your teeth before they prep them, and they send that impression out to the dental laboratory where a ceramist will fabricate those porcelain veneers. You go home with your temporaries, you come back when this porcelain veneer is ready, and they install the new veneers, the final veneers on your teeth. You leave the dental chair that day with essentially the veneers that you end up with a year from then, 2 years from then, and so on. The veneers are static, they don't change. This is not the case with rhinoplasty. In rhinoplasty, what you end up right after rhinoplasty is not going to be the same as what you'll have a week later, 2 weeks later, 3 months later, even 6 months later. It takes about a year and a half or so for all of the healing to take place, and the healing itself has multiple factors and variables to it. There's bone recontouring and remodeling, there is cartilage memory, there is lymphatic disruption and skin draping and scar formation and so on. So if you do 1 or 2 cases a month, rhinoplasty, and you always end up not knowing what the outcome is because you don't know what variable leads to what outcome. But if you're doing the same type of procedure over and over, you're self-critical, you keep notes. I used this suture, at 3 months the nose looked like this, at 6 months it looked like that. I used this other suture or this other maneuver or technique, at 3 months the nose looked like this, at 6 months it looked like that. I taped for a month versus I taped for 2 months. And you keep working these variables in an intelligent way, you finally optimize a recipe that decreases the margin of unpredictability. So now you've turned guesswork into anticipation. You've now learned to guide the nose to reach as close as possible to the outcome that you anticipate, as opposed to do the work and hope for the best. Have a good day, guys.